Hi, if you are bored of memorizing all of the different signs and symptoms and then explaining them and remembering the whole lots of data, then this video is for you. So this video regarding station 4 of the abdominal examination of the PACES. So it will be general schematic. Again, we will be doing everything according to a schematic plan, and if you follow those plan, you won't get stuck. You will just go according to the line. So once you are on this video, so I am already assuming that you have gone through the examination videos. You do know how to do the examination of the abdomen. You know all the steps of them. If you don't know, I will highly suggest first watch those videos, learn how to do an abdominal examination, what are the various steps involved with them, and then come to the schematics and learn the various different schematics. So this is just basically the starting of the scenarios. Then how will you do the scenarios, how will you pick up the signs, and how will you make a puzzle complete. So basically a patient will be there in this scenario in the abdominal examination. Basically the patient will have some sort of abdominal problem. That could be liver, that could be kidneys, that could be intestine, that could be anything in the tummy or spleen. So he will be there, you will have to pick up the findings, and then you have to make a diagnosis. So it will be just a puzzle you have to pick up. What we will do in these videos, we will just make an organized way to solve these puzzles, and we will make it fun. So, and again, there is one quotation that if you have the things organized in your brain, then these things get organized in your examination. These things are organized in explaining them, and then as a result you get to the diagnosis and you get a very good schematic way of explaining everything. So if you are doing these things, you just have to follow the schematics in the examination, and then you have to follow the same schematics in explaining these findings. So what we will do is we will do the same things in all the patients, in all of the abdominal examination. What you are going to do, you are going to start with the general inspection. Just see how the patient is. We are going to explain in every case what the patient will be looking like. Say for example, if the patient has some liver problem, he will be large, chubby, fatty with the fatty tummy. He will have bruise marks, he will have loss of hairs at the chest at the general inspection. So in the same way regarding every scenario. Then after general inspection, we're gonna start with the GPE and then going toward the abdominal examination. So our every examination schematics is gonna consist of 6 to 7 steps. Number first will be the general inspection. So you are just gonna see what the patient looks like, and we are gonna explain all the findings of every case of the general inspection. Then we are gonna start with the hands. So what are the findings at the hands of each of those cases? Then we're gonna go ahead with the arm and forearm. What will be the findings here? So you go in this direction, you go in the arms and then forearms, and once you are done till here, then you start from here downwards. So then you start at the face. So number 1 is your general inspection, 2 is your hands, 3 is your arms and forearms, 4 is your face, number 5 is your neck as well as your axilla. So there are some findings at the neck, lymph nodes, and then you have the axilla, axillary lymph nodes, axillary hairs, axillary pigmentation. So you're gonna look at those. Then your next step is looking at the chest. How is the chest? Any gynecomastia, any spironewai, and all of those things. So you're gonna look at those, and then finally you're gonna look at the abdomen, examine the abdomen along with, now the abdomen does include the inguinal region as well. So then you're gonna do the abdominal examination, and final portion you will examine all the legs. So if you follow these schematics, you won't miss anything. You will get through your diagnosis, and because you will know, okay, everything, whatever the station is, we will discuss it in the same schematics. We will discuss the findings in the same schematics, that what you are going to pick up. Okay, so and then you are going to explain it in the same schematics, and then you are going to get the diagnosis in the same schematics. So everything will be organized. You won't even have to remember anything, because everything will be sort of arranged on its own. So first go watch the videos of the abdominal examination, and once you have done the steps, you have memorized the steps, then you start with the schematics of each videos of each case, and then once you watch the videos you will just kind of memorize it on your own. So let's start with the cases. Yeah,